players in 2 years to Liz Frank injuries. And I was kind of just curious as to what exactly that was.
Yeah, so a Liz Frank injury is an injury to the foot, and it's kind of right in the mid-foot section. And what it mostly is, Liz Frank typically refers to a ligament. And a ligament goes from a bone to bone. So in the mid-foot section where the small bones in your foot called metatarsals, they key into some of the bones in the section in the middle part of the foot. And when that ligament gets hurt, it destabilizes that section of the midfoot. So it's not an injury you want. It's kind of an injury where the foot gets driven down in the turf. When that ligament tears, it takes a long time to heal without surgery, and frequently they're actual surgical injuries that just put people out kind of for the season, and then you got to, basically let the ligament heal and whatnot. So kind of not the one you want, unfortunately, but hopefully that gives you some insight into what it is.
Yeah, and when they do the surgery, what exactly do they do, and what separates one that needs surgery and doesn't need surgery?
Yeah, so a lot of times on x-ray, you'll see the bones will kind of splay apart, so they'll shift, and that tells you the ligament's been hurt. And a lot of times with surgery, sometimes they'll go in and try to actually repair that ligament. That's less likely. Usually they have to go in and try to actually put some kind of screw fixation to hold the bones in their normal alignment to let that ligament then heal. And then the last option, sometimes it gets hurt bad enough that they actually have to fuse those two bones together. So it just depends on the foot and ankle surgeon, but usually what kicks you into surgery is if you see the bones have shifted apart, because that's a problem.
All right, let's move on to knees now. I want to ask you something. And this may sound like a silly question, but back in the 80s when I was growing up, you heard the term bad knees, and people would get recurring knee injuries. When people have knee injuries now, is the surgery enough, or is there still a thing where, like, the person gets one knee injury, he's doomed to have them for the rest of his career?
Yeah, I mean, there's some kind of a genetic predisposition that can lead you to have bad knees, and one is sometimes people that have, like, remember when I was growing up, we called it being loose jointed or double jointed, and some people that have knees that kind of bend backwards a little bit or have more motion than they should are prone to injury, like ACL tears and problems like that. So some people actually have things that predispose them to injuries, and if you play a sport, basketball, football, run, cut, plant, pivot, that can lead you to a higher risk of having knee injury.
And one more question before I get into the specific ones. Does being tall or a bigger person predispose you to having knee injuries more than just like an average sized person?
Yeah, I mean, I think the larger you are, I mean, I always say we live on Earth where it's gravity, and the bigger you are, the more pull there is. And a lot of these tall athletes, I mean, it's a joint's the joint, and a lot of them don't have large muscles. So sometimes they're almost out of proportion. So it can definitely predispose them a bit to getting injury.
That brings us to a name that has knee injuries frequently, in Joel Embiid. He's sitting out the preseason due to a left knee injury, and he said he doesn't want to play back-to-back games this year for management of his knee. What management can somebody that's had prior knee injuries do to make them be able to get through a full season?
Yeah, so I mean, just with an injury like that, he's probably now dealing with some cartilage and almost degenerative arthritic problems that happen just from the pounding and the injury. So you're just trying to now manage the load. It's like all of us as we get older, you can't kind of, you don't wake up the next day always feeling as good. You know what I mean? So they're probably just trying to keep the mileage on his body such that, the knee doesn't swell, it doesn't hurt that bad, so that he can perform. And if he goes back to back, you have, the joint probably will swell more, it hurts more, it affects everything, including his performance. So they're just trying to make it so that he can play and be effective.
Another NBA player that has struggled with a knee injury is Jamal Murray, and he said he just woke up and his knee felt funny, and he tried to play through it and loosen it up. Is that something you can actually do? Is your knee just tightens up and you can play through it, or would you recommend maybe getting it checked before you get out there?
Yeah, those are always tough. I hear that a lot, but honestly, I mean, you can. So say maybe the previous day he did something, irritated the knee, didn't feel it, then overnight the knee swells. That can happen. So when you wake up, the knee's kind of swollen, a little bit tight, but not terrible. And then they go out and just see if they can get it to the point that it just frees up enough to feel like they can play. Typically, it's not a sign of like a significant injury, more of like an annoying problem or tissue or something inside the joint gets inflamed causing that. But that certainly can occur. But usually the good news, it's not something that's long term.
What kind of knee injury? Because there's a couple guys in the NFL that are day-to-day with knee injuries. What kind of knee injury could you be ruled out for just a couple days, but yet be able to come back if needed in a week or two?
Well, I mean, that goes back to kind of some of it. I mean, these guys have such miles on their body. I think to get to pro, like say the NFL, they've been probably the best football players since Pop Warner. So they've been taking hits like since then. So what happens is they accumulate miles on the joint. A lot of times it can be starting to get early arthritis. So then you got to just manage. So it's not an ACL tear because you can't play with that, or any significant ligament injury. You can't play with those. If you have a bad meniscus tear, you can't play with those. But if it's more minor, say a small little meniscus tear, a little cartilage damage, then it's like you kind of just have to manage them from a pain standpoint. Like the joint is stable, it works well, but you got to kind of just not let it get beat on too much.
That's the second time you've mentioned arthritis. Has there been any movement in getting rid of arthritis or treatments for arthritis? Because, I grew up hearing commercials for it, and it still seems like it's going and going on everybody.
Yeah, so arthritis is wearing of the cartilage in the knee that lines the ends of bones. And unfortunately, we have not, it's kind of the holy grail that we have not solved yet. You'll hear more about PRP, you'll hear more about stem cells, and all of the intent there is, can we somehow get this cartilage when damaged to heal? And unfortunately, we haven't. We're kind of moving in that direction, but it hasn't been definitive yet. So we're still dealing with it, and obviously the end stage when it really gets worn out is a knee replacement. But a lot of these really high-level pro athletes, they've put a lot of miles in their body, especially the physical sports, and they start getting this early arthritis, which may not bother them much if they're sitting at a desk or, but when you're trying to play the sports they are, it is a problem, and that's where you got to just manage them.
All right, one final question for you. Packers wideout Dontavian Wicks out with a shoulder sprain. How long does a shoulder sprain usually take to repair, and what does he have to go through to get through it?
A little bit depends on which part of the shoulder was sprained. Probably one of the most common areas is up top where the collarbone meets the shoulder. That's called the AC joint. You'll hear that called an AC joint sprain. So if that's sprained, that's kind of day to day, week to week. Pretty low grade sprains. Usually within a week or so, they're feeling better. Those are actually sometimes ones we'll actually inject with cortisone because it doesn't affect them. If it's more of a sprain of the ligaments that support the shoulder, say he dove and the shoulder slipped on him a little bit and tried to almost come out of the socket, that can sometimes take a little bit longer, but it's still typically a day-to-day, week-to-week. And once they get full motion, full strength back, and the pain's tolerable, they're usually good to go.
Is a shoulder injury also different sport to sport? Like, it seems like an NFL guy, while he's going to get hit on it, it would hurt more, but he's not using it as much as, say, a baseball player or an NBA player.
Correct. Totally sport specific. Baseball, it's obviously throwing, so those guys get throwing problems, rotator cuff problems. Football, it's just such brutal contact that a lot of times those hits that look like kind of just collisions, a lot of times it can make the joint slip. Can sublux or even dislocate. And then, of course, you have the brute trauma that can hurt it. In hockey, you'll get a lot of AC joint injuries from guys getting checked into the board. So, yeah, it really depends on the sport. And then it factors if you can play with it. And then even like in football, really, the position within the sport will dictate what you can play with and what you can't.
All right, that's our SOS house call. Dr. Ryan Smart, thanks for your time. We love doing this.
Well done, Paulie.